Hey, welcome back to the AI Equation Podcast, your guide to your latest news and the advancements in artificial intelligence. There's so much to talk about between everything that's happening with Google, that came out of Google I/O. Of course, you had Microsoft talk about Copilot, ChatGPT 4.0. We've been covering so much, not only here, but on our website, in the news section of the website, the blog. A day in the world of AI feels like a year. It's like a fire hose of information. I'm your host, Alex, and in today's episode, we're going to talk about a topic that impacts us all. Because, as I said, there's so much happening in the world of AI, and if you're following it, it's really hard to keep up. So, what I want to really try to do today is dive into a topic that truly impacts us all, no matter where you live in the world, and that is mental health. And I have a thing or two to say about mental health because I have worked for years with NGOs as well as healthcare providers, therapists, psychiatrists in a marketing role, helping them grow their practice, right? And today we get to use these tools like ChatGPT or Article Factory and others that will help us create content, right? But what I want to do is really explore the other side, some of the innovative applications in AI therapy and diagnosis, uncovering how technology is reshaping the landscape of mental health care. All right. So there's this doctor by the name of Lance B. Elliott. He's a leading expert in artificial intelligence and machine learning. And he has been exploring the implications of generative AI on the population's mental health. And in his recent column, Dr. Elliott looked at the complex dynamics that arise when millions of individuals turn to AI for mental health guidance. And the numbers are startling. I know from a few other polls and surveys that I've looked at, depending on the age group, like for example, Gen Z, it's estimated that up to 40% of them are using ChatGPT for mental health as a mental health guide. And there's certainly an ethical question there. And I think that some people in the world of AI are turning their cheek because, look, after all, it's a way for a lot of people to monetize people's time, to be able to build their large language model. Now, unlike traditional approaches that focus on individual mental health outcomes, Dr. Elliott emphasizes the need to examine the broader population level effects of generative AI usage. And by stratifying users based on the engagement with AI for mental health purposes, Dr. Elliott sheds light on the diverse ways in which AI is shaping our collective well being. From active users who rely on AI for ongoing guidance to occasional users who seek assistance intermittently, Dr. Elliott provides a comprehensive overview of the various segments of the population affected by generative AI. He also addresses the ethical considerations surrounding privacy, bias, and the potential for both positive and negative impacts on mental health. Drawing on recent research and real world example, Dr. Elliott underscores the importance of policies, regulation, and societal norms in navigating the evolving landscape of AI driven mental health care. He highlights the need for interdisciplinary collaboration and ongoing dialogue to ensure that AI technologies are leveraged responsibly and ethically to support mental well being. And look, having seen it from different angles, different points of views over the last couple of decades, different organizations I've worked with, whether it's adults with disabilities, organizations that work with children who are on the spectrum, organizations that work with Alzheimer's patients, just a lot of different healthcare needs for different populations. I don't think that there's a replacement anytime soon for the human aspect, the nurse, the doctor, right? That is going to actually have that one-to-one conversation with you that is driven by emotion and is driven by an energy between two human beings. The generative AI could process information, trillions of what would take trillions of neurons and multiple brains with very high IQs to do in real time, but it cannot have that human to human connection. Now, AI powered therapy solutions. Let's look at that. There is an emergence of AI driven chatbots and virtual therapists designed to provide mental health care guidance. Um, BetterHelp and some other platforms are experimenting with this right now. The sort of the results are not truly out yet because they do this in sort of small focus groups. So we don't know what the benefits of these digital interventions, such as accessibility, anonymity, and scalability, really are in reaching individuals in the need of assistance. So we're going to keep an eye on it because I think it is a topic that impacts all of us, and especially at a time where we know that social media and the world of the web in general, Web 3, is impacting our young people in such a negative way, that the only way to keep yourself mentally healthy is to just completely disconnect, which is near impossible, especially if you're telling young people to do that. Now, one aspect of mental health that I think is going to be really good in regards to using AI is the predictive analytics. So crunching the data, examining how um, the analytics and machine learning algorithms are being utilized to identify patterns and markers associated to mental health conditions. We've seen a few different applications that are highlighting that potential for early detection and intervention through AI powered predictive models, leading to more timely and effective treatment outcomes. While those things are really good, on the same token, I feel a little bit conflicted because you look at some wearable devices, even the AirPods from Apple, where they're going to be using certain sensors. And then you have different ones that are reading your temperature, body language through camera. You have to be concerned about your privacy and your security and what they're going to do with that data. I mean, I think of companies like 23andMe, where they promised that they wouldn't, use that data for to do basically for monetization, right? Which is good for them, bad for you. So I am skeptical in that way of the different companies that are building out technologies in this space. Although, having talked to some of the doctors that we work with, personalized treatment plans and being able to do it virtually, exploring how you can enable real-time treatment plans virtually is a big help, right? And of course, I've talked to doctors on both ends that feel I'm not going to use AI for any of this, not even to crunch my patient's data. I don't want this data out there. There's this, client provider privacy concern, HIPAA concerns, and of course, you are afraid of these big, vast data sets um, getting in the wrong hands of different people, and then to think about how it's going to recommend customized therapeutic interventions, medication regimens, and lifestyle modifications. That's very hard to do, and I do side with the less, I would say, edgy therapists out there who are saying no. This is not, it's not yet there, where you can just put someone in front of a bot virtually to be able to have those discussions that are deep. Now, the ethical considerations to me are huge, and I think they have not been addressed, right? Surrounding AI in general, but specifically AI in mental health care, which is the conversation we're having today, which include privacy concerns, data security, and algorithmic bias. We know that companies like Google, Microsoft, Apple, Amazon, Meta, Facebook, all of these companies have violated the rights of all of their customers. Yes, all of their customers, absolutely. They have been found guilty over and over and over again for taking our data, our usage, and using it for their own, profit. to profit from your data. And they all buy and sell data to one another so that they can each grow. And it's a really nasty cycle in our Congress. I mean, we've talked about this here on the show before, the different bodies, whether it's the Congress and Senate, right? Our legislative body here in the US, or the executive office with the any president of the United States. I mean, look, if we go back, Biden, Trump, Obama, Bush, Bill Clinton. So Bill Clinton is probably the first one that had the opportunity to address these issues. But when you look at Section 230, at least in the United States, it is the loosest of all of the developed countries. Which basically says that it just allows all of these big tech companies, it allows them to do whatever they want with your data. So I'm definitely skeptical of what is happening in AI and mental health care. I believe that where we can use AI and not worry as much about ethical questions exist in different use cases, like marketing for one, right? But for mental health, it's a tough one, right? And then empowering mental health professionals. I do believe that this is going to be a great one, because in general, we've had that conversation here. Most people that want to use AI today want to use it for their productivity, so that they can grow their own careers and do their jobs better, focus on doing what they do well, and then what they are not so good at and maybe is completely a waste of time, like different workflows. Let the AI, the bot, do that for you, right? So it's augmenting the capabilities of mental health professionals to to be able to, I would say, outsource, but outsource to their own bot, not like a general bot. The the ways in which they diagnose, and the way in which they write out treatment plans, and of course patient monitoring, right? Like, so there could be notifications that are put in place, and the speed to contact, the speed to address the issues will be faster. So I feel like when it comes to empowering the mental health professionals using AI, there are several companies right now that are developing B2B solutions for the healthcare industry. Really interesting things. But a lot of these programs, the fact is, are in beta. And listen, all of them are using either, Anthropic, OpenAI, Microsoft, which is a combination, obviously, of OpenAI and Microsoft. You've got IBM with the original with Watson. You've got Google with Gemini. And then there's a bunch of others, right? Perplexity, and just the use cases are all different. But those top 5 AIs, they're the ones powering a lot of these technologies, right? Now, what we did was look at different resources that we think could be helpful for you. One that my wife turned on to me years ago, I'm talking probably, gosh, I don't know, 10 years ago, is the We Can Do Hard Things podcast, right? That's Glennon Doyle. She's that best-selling author of Untamed, and she joins her wife, soccer star Abby Wambach, right? And her sister Amanda Doyle, to talk candidly about how to overcome hardships every day. I mean, they cover everything from addiction to career trouble to taking care of parents and maintaining friendships. So that's a really good resource podcast for people looking for um, um, topics around mental health, right? And then The Hilarious World of Depression. I personally have not listened to this one, but it's not often that people can laugh at depression. But public radio host John Mole captured Dogolf's attention for highlighting the plight of coping with clinical depression and the stigma in highly relatable approach. So I will definitely be listening to this one, but it was one that was recommended by our team. And then as far as apps, I'm not huge on the apps like Headspace, BetterHelp. I do like, and full disclosure, I have an investment into heal.me. And then I have other doctors that and therapists behavioral therapists that I have worked with for years. And so I'm not going to give them a plug right now because obviously our podcast here is about AI. And we just happen to be talking about mental health today. But I'm a big believer that the best way for you to take care of your mental health is still to go see a therapist face to face. I think that the world of AI right now, it's like the wild west. Think of the internet when it started. A lot of mistakes were made and everything swept under the rug. And then we did that again with smartphones. We did that again with social media. And by the way, here we are decades later, and those problems have not been fixed by the government and by the tech companies. So that is the takeaway. I know it's probably for many of you that are listening thinking, whoa, that was not such a positive way to finish off the podcast. But I do think that AI is going to revolutionize the field of mental health and offer new avenues for support. I did highlight some areas where I think is good, like empowering the mental health professionals, right? But I think we're far away from that. And as we've seen, the intersection of artificial intelligence and mental health care does hold immense promise in some of the moving parts for ultimately improving the outcomes and transforming the lives. Thanks for tuning into this episode of the AI Equation. Be sure to subscribe for more insights into the fascinating world of AI. Until next time, take care of yourselves and each other.